Hello, practical nursing students. This is Darlene LaPresto, nursing instructor. And on this video, I'm going to be showing you some respiratory devices that we use when supplying supplemental oxygen to our patients, or maybe they're going down to surgery. First item that we have here are called airway kits, endotracheal tubes. They come in all different sizes, from infant to pediatric to adult and to large adult male. Okay, goes over the tongue and just to the back of the throat to keep the tongue down and the airway open, so it doesn't go down the throat. Now these ET tubes, they go all the way down the trachea, and again they come in different sizes. There's a balloon on the end that can be filled with air so that it holds it within the trachea, but we have to be careful about damaging the trachea. Notice they're marked for x-ray purposes. Okay. Next we have what's called a Yonkers catheter. This is a suction catheter. This is for oral suctioning. It's hooked to the suction tubing here, and then this is the tip that you place in the mouth to suction extra secretions from the patient. This is an oxygen flow meter. These are what you'll see mounted on the wall. They'll have a green Christmas tree device at the bottom of them, and that's what you hook the tubing to. And then with this one, it's controlled with this dial, and you adjust the liters according to the doctor's order. Those are on every wall above every patient bed in the hospital. This is an incentive spirometer. You're going to learn about how to use these, and you'll be teaching your clients how to use these. You suck on them like a straw through the mouth device. You do not blow into it. Okay? You suck on it, and that makes the lungs open up those alveoli so the patient doesn't develop any post-op complications while they're in the hospital. The point is to elevate this diaphragm and then hold it for several seconds, so you can change the goal for the client by moving this yellow indicator up and down, and they need to do this 10 times every hour. Now what we have here are different kinds of oxygen delivery masks, and it just depends on what the doctor orders and how sick the client is. Usually you're going to see tubing similar to this that's called nasal cannula, and it has the two prongs that go into the nares, and oxygen is delivered that way. This is just an extension tubing. You need to know where those are kept in clean supply in case you have a patient who can't quite reach going to the bathroom because their oxygen tubing is too short. Go get another extension set. So know where these supplies are kept when you get to the hospital. This is a trach mask. It goes over the neck for a tracheostomy patient. Same way with this one. It fits over the stoma, and then it's tied around their neck. And you'll see some pictures of what a tracheostomy is in class. This is a non-rebreather mask. That's why it has the bag on it. And then here we have a venting mask and a non-venting mask. And you'll learn more about these. I'm certainly not an expert on these. Respiratory therapy in the hospital are the go-to people to help you learn these different oxygen delivery devices. And I will provide some paperwork in class that tells you what % of oxygen are delivered via those different masks. All right, and that concludes the respiratory. Thank you.